How you doing? My name's Rusty and I'm here to talk to you today about the American Heart Association's serious signs and symptoms. They were developed to help us determine if our patients are stable or unstable. If you are a laundry list type person and you can memorize things on those lists, great. I'm not one of those people. I have developed some hand and arm signals to help me and my students remember the serious signs and symptoms. A few years ago, one of my students said, "Man, that looks like some baseball signs that a third base coach would give the batter to either swing away, bunt, or take the pitch." So that's why I have my baseball jersey on today. The first serious sign and symptom we're going to talk about is altered mental status. Altered mental status signal is hand on your forehead. Not that you should have had a V8, but altered mental status. We assess our patient's mental status by AVPU, A-V-P-U. Are they alert? Are they responsive to verbal? Are they responsive to painful stimuli? Or are they unresponsive? AVPU, A-V-P-U. If they are alert, then we are going to make sure they are alert and oriented times 4. Alert to person, place, time, and event. A&O times 4. So when checking your patient's mental status, use AVPU and A&O times 4. If they can't answer any of those questions correctly, then they have altered mental status, and that's one of the serious signs and symptoms. The next serious sign and symptom is acute heart failure. If your heart is not pumping blood out to the body, then it's backing up in the jugular veins, and they get distended, or JVD. So, acute heart failure sign and symptom is looking for that JVD. We have altered mental status, acute heart failure, or JVD, and then we look for chest pain, that Levine sign, substernal crushing. Altered mental status, acute heart failure, or JVD, chest pain, and then we're going to put that blood pressure cuff on our patient and assess for hypotension. If they are hypotensive, that's serious, and that makes them unstable. Last but not least is signs and symptoms of shock. We're going to look from head to toe for those signs and symptoms of shock. Is our patient pale, cool, diaphoretic? Because if they're diaphoretic, they're fixing to die, and that's a bad thing. So let's review. We have altered mental status, acute heart failure JVD, chest pain, hypotension, and we're going to look from head to toe for signs and symptoms of shock. If they have just one of those serious signs and symptoms, it's serious, and that makes them unstable. Hopefully this helps you out when you're assessing your patients and you can look for these signs and symptoms to rule them out to hopefully have a stable patient. Altered mental status, acute heart failure, or JVD, chest pain, hypertension, signs and symptoms of shock. Remember them, they're serious. Have a good day.